Welcome to The Hill's Coronavirus Report. I'm Steve Clemons, editor-at-large of The Hill. Each day we are interviewing consequential international, national, and state leaders in the battle against the coronavirus. As you know, state governments have been in the thick of the war against the virus. The state of Florida is one of the top 10 hotspots in the U.S. for the most reported COVID-19 cases. That's according to data from Johns Hopkins University. Stats from the state of Florida reveal that 27% of deaths there have occurred at long-term care facilities and nursing homes, but cases weren't limited to those places. Recently, I talked to the mayor of Miami, Francis Suarez, who himself has been diagnosed with coronavirus. While Florida's Governor Ron DeSantis says he's inclined to give the go-ahead to elective surgical procedures and begin to introduce other soft openings, the safer at-home order the state has adopted will be in place until at least the end of this month. DeSantis says he will take a measured approach to reopening the economy. My next guest serves on the 5-member congressional commission overseeing the multi-trillion-dollar coronavirus relief package. She also happens to be from Florida. Congresswoman Donna Shalala also has the great distinction of being the longest-running Health and Human Services Secretary in U.S. history. She's a double package. She is one of the key architects of the Reopen America Act that seeks to prioritize science, data, and expert panels to help governors and the federal government reopen the country responsibly. And of course, she represents Florida's 27th district. Representative Shalala, thanks so much for joining me today. Usually when representatives introduce legislation like the Reopen America Act, it's because they have concerns that we're not going to reopen the country the right way. So what are you trying to fix, or what are your biggest concerns about the reopenings and the process we've seen thus far?
That it's erratic, it's not systematic, and it's not necessarily based on science, but rather on a lot of pressure to open up the economy and for people to get back to work. And I'm very worried. We haven't done the level of testing we need to do. We don't have the supplies that we need to test even the healthcare workers or even the people that are cleaning the buildings in our healthcare institutions. We haven't tested everyone in the grocery stores or in the drugstores. We're not anywhere near where any scientist, physician would say it's time to reopen. And some of that is because the federal government has not done what it needs to do. We don't need a lot of lists of guidance from the CDC. We need the federal government to be the purchaser of all of this PPE, this equipment that we need, the testing devices. They have, as a single buyer, they can drive down the prices, they can purchase in large quantities, they can distribute it around the country. They have the most magnificent military in the world that are used to doing these kinds of things. Second, the states need to have similar strategies in relationship to the science. We can't have governors. Many of them are trying hard. We can't have governors have different strategies based on different facts, opening up their states. Because what about the state next to them? This disease does not know what state it's in. This virus is going to continue to move around unless all of the states have similar data and similar strategies with the adjustments they need to make for their own states. Rural states may have a slightly different approach than urban places. I represent Miami, for example, and the beaches, and we would have a slightly different strategy. But this is about data, not about a date. And this virus needs to be squeezed. We need a hammer on it to get it down, all the way down before we open up.
Right. Mayor Suarez, when I interviewed him, said that Miami had been the first place to have a stay-at-home order, to have a curfew in place. And just talking to him, you could tell that he was taking this whole challenge very seriously. Your governor seemed to be at that time in a very different wavelength, and you had beaches open and you didn't have the same form of strict orders. Is the state beginning to pull together, or is it still at odds internally over how to handle this?
I think I think our governor is new. He's a rookie. He's being pulled in different directions. Our unemployment insurance system has been a disaster, and he's been focused also on that. But again, we are not getting clear direction from him in which every part of the state is staying in place. This opening up of the beaches is dangerous. The opening up of golf courses, in my judgment, makes no sense. We don't have a statewide strategy as such. And so you have mayors that are tough-minded, that are paying attention to the scientist physicians, like the mayor of Miami, the mayor of Miami Beach, the mayor of Cutler Bay and Palmetto Bay, the mayor of the city I live in, Coral Gables. They're being much more restrictive, much more tough-minded, and they're all admitting we don't have the testing in place that we need to have in place before we open up.
So let me ask you about that. And you know, I know there's partisanship in this. I know that, you know, Democrats are critiquing Republican leaders, vice versa. But just as a structuralist, as someone who has run big bureaucracies, you ran Health and Human Services, you've run a major university. I just am scratching my head wondering what is going on, because there are lots of good people in government, in the CDC, in the FDA, that understand, that are not run by, you know, political tracks. What has gone on? I mean, what is in your gut has kept this from working the way it should have worked?
I think the White House, basically the White House and the leadership, or the lack of leadership, the erratic leadership of the president. He is literally, Steve, dangerous to our health. He moves from one side to the other. He makes one decision and then says, well, let the states do it. This is the United States of America. We're not back to the Articles of Confederation in which the states were fighting with each other. The states are competing with each other for testing supplies. The hospitals are competing with each other. We don't have a national strategy. We have a national list of suggestions. You cannot deal with a virus this way. You've got to use the scientists, physicians, the world-class people at the federal level to not only give us advice, but to approve state plans. We ought to fund state plans. This ought not to be left to state budgets. We ought to be funding state plans, but they've got to be based on good science, or this virus is going to continue to spread across the country and to spike across the country.
Now, I know you've been working closely with Representative Jayapal and another piece of legislation that could be part of a future coronavirus relief package, and that is paycheck guarantees, along the lines of what France and many other European countries have done, which is really locked in upwards of about 75% of people's pay during this period of time. The United States chose not to do that, or has not done that way. It's done unemployment insurance and other benefits for small businesses. But I know that you're very, you just mentioned it, the unemployment problems, the unemployment insurance, and people that are, I mean, the staggering numbers of unemployed out there, despite lots of money going to businesses to hopefully keep their workers in place. So give us a snapshot of the Donna Shalala dashboard on that unemployment challenge and paychecks.
You know, what public administrators would normally tell you, and policy people, is if you want to fix a problem, use existing platforms and just beef them up somewhat. And that's what we did. We took the small business platform, we took the unemployment insurance, and it turns out that there's no way they could absorb the numbers in this crisis.
Right.
They just didn't have the infrastructure to do that. So I have increasingly migrated with my colleagues, led by Representative Jayapal, to a plan in which the internal revenue, which has data on the payroll of every business in the United States, on them just writing checks. The only money we got out quickly was when the IRS sent checks, $1,200 to each individual, plus $500 for whatever child they had. That was an efficient way of getting money out. In my experience, the federal government is at its best when it gives scientific advice and when it gets money out, when it writes checks, basically writes checks out quickly. So Social Security is a perfect example of where it's a highly efficient system. And this system of sending checks out, $1,200 checks, is really highly efficient, despite all the funniness about putting the president's name on. Forget about that. We got the checks. We got the checks out. The SBA system and the unemployment system simply were not prepared to get checks out quickly. So I'm not so sure we ought to continue in this way, as opposed to going to the IRS, taking a look at the payroll, and figuring out a way in which we can help businesses by absorbing their payroll for a period of time and giving them some money at the same time for benefits for their employees, as well as a little for overhead. It's a much more efficient way to get the money out. I just want to get people's paychecks back to them for a period of time as we're going through this transition, because that's what people need.
Are the prospects for that legislation and that paycheck guarantee and solving this problem high in the next round, or do you think it will be a struggle?
Oh, I think it'll be a struggle. I think it'll be a struggle. I think people are wedded to the SBA, even with all of the disaster of the wrong people coming in for the first loans, the big banks taking care of their customers who they've been dealing with for a long period of time, as opposed to their depositors. I think it's going to be a struggle. But when you think about it, we should think about ways in which we can protect people's paychecks as quickly as possible. And, some states have gotten the unemployment money out. My state was an absolute disaster because it had a system designed to say no, not to say yes. And we added on new groups, the gig economy, people who had been furloughed as opposed to let go. And so we made the system, we made the requirements more complex, and they weren't ready for the numbers. So I want to help people get their income back during this period that we're going through. And therefore, I'm willing to throw up my hands and say, let's do it in a more efficient way.
One of the things we saw in the last couple of days was what I call a do as I say, not as I do moment, when the vice president went to the Mayo Clinic and didn't put on a mask. This received a huge amount of attention. If you were a cabinet secretary again, or you were vice president of the United States and visiting the Mayo Clinic, would you wear a mask?
Absolutely. And in fact, most of us wore masks when we went back to vote. We wore masks in the chamber. I wore a mask all day long. Even when I did the interviews, the stand-up interviews over in the Cannon building, I wore my mask. I mean, we're leaders, and we have to send a clear message. And the vice president should have had his mask on. When I was secretary of HHS, if there was a mask requirement, I had a mask on.
One of the things Senator Chris Coons told me the other day, and I also had a conversation with former Senate Majority Leader Bill Frist, is that many people saw this coming, that this notion of just being reactive to a virus now and getting all the infrastructure up to deal with it is a kind of betrayal of the fact that many saw this coming. Many have been warning about a major pandemic of this sort and the infrastructure deficits, both in creating new platform vaccines, but looking at broadly at manufacturing. You were in a role that was responsible to some degree before in thinking about this. And I'm interested in whether or not, once the coronavirus is over, whether you think there will finally be the political will to not just be reactive and look longer term at a very clear vulnerability for people in general, but particularly for the United States.
I hope so. I can't guarantee that. Let me say that in the 1990s, we actually put some things in place, but it was like pulling teeth. We knew that the public health infrastructure in this country, the state and local public health departments, which were partially funded by the CDC, as well as the laboratories, were weak in terms of a pandemic. And so we made some investment in them. The stockpile that's being discussed now was part of our initiative, as was the Assistant Secretary for Pandemics, as was putting a healthcare expert on bioterrorism, actually, in the National Security Council. We did desktop exercises on pandemics, but getting the resources, people's eyes glazed over when I testified on this subject, but on the public health infrastructure in particular, on the state and local public health people. We're getting our comeuppance now, and we better be ready. We better have a readiness system and a system in which we can produce both the vaccines as well as the drugs that we're going to need in any kind of treatment plan. I don't know whether we're going to get a vaccine. We never got a vaccine, if you'll remember, Steve, in AIDS, but we got a treatment. And it's easier to make a pill than it is to make a vaccine.
Right.
I was so nervous in the 90s about the flu vaccine that we figured out a way to make the flu vaccines in the United States, because I was so concerned that if we had to use an international system, that we wouldn't have enough doses for people in the United States. So we're going to have to look at all of that as well.
Right. In our last minute or so, one of the questions come up. Yesterday I did my interview on the subject of trust, and there have been a lot of discussions about public interest and private interest and those crossing over. Of course, you've had a lot of concerns about President Trump over time with private interest, and the stock sales have come up. And you've been talked to about your stock sales and have said it was a mistake, and I don't want to get there. But I want to ask what the public should expect in these moments about public trust and public officials, and what standard we should be setting at this time, and get your insights into that. You know, I know you're in that storm, but I would love to just know from you what the public should be expecting.
Well, I think the public has found out over these months that government is important, and that that standards for public officials are also important. But the importance of government, we spent years, and this administration has enforced cutting the size of government and not filling important positions at the CDC, at the FDA, in the Public Health Service, and it's been to our detriment at this point. And of course, we have to have transparency, and we have to have accountability. And I believe in both of those. But I think parents at home with their kids are finding out that their teachers are really important. I think they're beginning to see the role and the importance of the public schools in particular, because most kids in this country are in public schools, and the importance of those teachers. And we're seeing in our world-class scientists the importance of the investments we've made in those scientists, and the disinvestments that we've made, and the heartbreak of having a CDC that had to struggle, and a public health service that has had to struggle in this pandemic. So I think faith in government is going to return, and faith in the people that teach our children, provide services for the elderly, and lead states and local governments, as well as who leads our national government, both in the cabinet as well in the presidency, that this makes a difference whether we live or die. That this is not just about, whether we're healthy economically. This is about life and death, and the quality of that leadership, the transparency, the accountability, has to do with life and death.
Well, thank you very much, Representative Donna Shalala. Thank you for joining us, and thank you to all of you for joining us. This is the Coronavirus Report. We run it daily. I'm Steve Clemons. Be well, and see you tomorrow.